Hello and welcome. We're coming to you from the Apollo Athena Cancer Conclave 2026, where some of the country's leading cancer specialists have come together in Asia's first dedicated cancer conclave for women to discuss a very important issue. How do we move breast cancer care in India from uncertainty to clarity? Breast cancer today is actually the most common cancer among Indian women. Yet many treatment decisions are still influenced by fear, outdated practices, or lack of multidisciplinary care. But medicine has moved ahead from precision imaging and targeted therapies to breast conservation and reconstruction. So today we are asking a very important question. How do we ensure that this science reaches every patient? Before we begin this conversation, we listen in from Dr. Pratap C. Reddy, founder and chairperson, Apollo Group of Hospitals, about breast cancer.
Breast cancer is now the most commonly diagnosed cancer among women in India, according to roughly 28% of all female cancers, according to the IMCR and the National Cancer Registry programs. This growing incidence calls for a shift in how care is approached. Apollo's vision therefore places equal emphasis on early identification and risk reduction alongside the treatment.
So let's begin this conversation. Joining me today are 5 experts who are helping drive that shift and helping in that conversation. Dr. Geeta Khadyaprath, leading breast surgical oncologist. Dr. Venkat Ramakrishnan, plastic and breast reconstructive surgeon. Dr. Jyoti Vadva, leading medical and precision oncologist. Dr. Jyoti Arora, breast imaging specialist. And Dr. Kavita Jain, senior consultant in Pathology. Thank you all for joining in. You know, I want to begin by asking you, Dr. Geeta, first of all, that, this breast cancer is just so common in the country nowadays, I wouldn't be wrong if I say that all of us would know somebody or the other who's got breast cancer in our own private circles, isn't it? 1 in 28 women in India are likely to develop cancer in their lifetime. The numbers in urban centers are as high as 1 in 22. What I want to ask you is that in spite of so much, in spite of this incidence, high incidence, why is there such lack of awareness around breast cancer, and why the stigma associated with it, first of all?
So I think it is a mix of things. It's a cultural thing. It is a strong sense of denial that it could not be happening to me. And I can assure you it has got nothing to do with your educational status. We see a lot of educated women coming in with advanced cancers, primarily because of this strong sense of denial. And then, of course, access to care. Sometimes, you just know that you don't have access to the care that a cancer requires, because in their mind they may think it is, but they don't land up coming to any form of treatment because they realize that they will not be able to see it through. So a whole lot of things that, lack of awareness included.
Dr. Venkat, I want to ask you, because this has been an experience I've seen in my own family, like with my mother, who's like, for example, she's had a breast cancer incident and she's also a survivor. So the first worry that my mother, for example, had in her mind when she was diagnosed with stage 1 breast cancer was that, oh my God, I'm going to have to go through a breast removal surgery. Is that a concern, doctor, that you see in many of your patients?
Certainly. I think, the first concern would be about the cancer and survival, and the next one would be about losing the breast, and some would consider loss of their femininity.
Exactly.
So it is a fairly big deformity for the woman. Because the price is so high with regards to saving the life, they cope with it. And that's what happens most often. Today, the reconstruction awareness is very poor, and that would certainly help the woman to get over this.
So this has got a lot to do with body image as well, unfortunately, isn't it? That I'm not going to be the same person anymore, and that is where the role of doctors like you comes in, isn't it? How important is it to send out the message that we've arrived at a space in science now where reconstruction is possible, and getting back to as good as it was before is also possible, doctor?
Certainly, what you say is so true. Today, with the development and where we are with advances, survival itself is not the finishing line.
Absolutely.
Certainly, to rehabilitate the patient in full, getting them back to normal life is what we aim for.
Dr. Geeta, coming back to you and the diagnosis part of it as well, I want to ask you particularly about biopsy. Talk to us about this procedure and what is it that patients can now expect as far as advancement in medical science is concerned, because I understand biopsy by itself, correct me if I'm wrong, is a very painful procedure, isn't it?
Not at all. Actually, I would
Okay.
think that, a biopsy is better than an FNAC in a lot of ways, because FNAC, the fine needle thing, is done without anesthesia. Biopsies are usually an image guided, it could be an ultrasound guided biopsy, which is a needle biopsy, wherein the patient is given local anesthesia, and then a needle is inserted into the tumor under guidance. And a lot of people shy away from biopsy because they seem to think the biopsy is going to cause the breast cancer to spread, which is not true. So our starting point is actually a biopsy. Because biopsy is not just about confirming diagnosis, it is also about telling us what kind of tumor it is, because the treatment would vary basis the kind of information that a biopsy can give us. There are various kinds of breast cancer treated differently basis the report that we get. So a biopsy is an absolute essential to the treatment of breast cancer.
Dr. Jyoti Arora, I'm going to bring you in. Imaging is extremely important. Talk to us about the role of artificial intelligence in it, and what are the kind of advancements that have been made in the area of imaging also that have made things much more easier for you as a doctor,
So when it comes to advances, we have 3 Tesla MRs, and these MRIs they have AI tools within them, so that brings a lot of precision in our diagnosis. So when we tell our surgeon that there is a tumor, we exactly tell. Many a times tumor is not a single lump, there are multiple smaller lumps along with it. So we tell them the exact extent of the disease so that they can tailor their surgery accordingly. So we want to be safe for them, as well as at the same time we want to give them good cosmesis. So we want to remove as much as it is necessary, but not extra. And in this, radiologists play a very important role, and the tools that are helping us are AI in MRI, in mammography, because they help us pick up very, very subtle lesions, but also techniques like MR guided VABs and ultrasound and tomo guided VABs, because they help us tell us that the small lesion that we have picked up on an MRI, whether it's truly a cancer or not. So we have to go and biopsy those little tiny foci as well. And that's the time when we need to add supplemental screening. Now, supplemental screening can be added in the form of ultrasound, but it's always better to go for an abbreviated breast MRI or a contrast enhanced mammo, because they can show many more tumors.
Every year, even if you don't have a risk factor?
So dense breast, if you have dense breast along with, say, suppose there is a family member, then it's really advisable to go for abbreviated MR every year.
Okay. Dr. Jyoti Vadva, I want to ask you, some people, including celebrities, have gone on to remove their breast because of, as a fear that they would develop breast cancer at some point in time, if it is in the family, if it is genetic. Do you see that happen here as well? Or do you have queries around all of this as well?
Yeah, definitely. So it all started many years ago with Angelina Jolie.
Yes.
And it's known as Angelina Jolie effect. And what it led to, the good thing it led to, was that it increased the awareness amongst the general public that such a thing exists, that there are these genetic alterations, if inherited, like BRCA1, BRCA2, and some more, that increase one's risk of developing not only breast cancer, but some other related cancers as well, such as ovarian cancer. So then one of the ways then in asymptomatic people is to undergo these risk reduction surgeries. They do not fully 100% eliminate the risk of developing that site's cancer, they do not bring it down to 0%, and therefore you do need to undergo screening tests.
Okay.
But they definitely lead to a significant reduction in the risk of developing, say, breast cancer if somebody chooses to undergo prophylactic bilateral breast removal surgery.
Dr. Kavita, I'm going to bring you in this conversation. Talk to us about scan surgery. The final treatment roadmap actually begins in the pathology lab, doesn't it? Can you explain how oncopathology helps doctors decide the best treatment plan here?
So that's true. We hold answers to many apprehensions. Patients keep waiting for these reports, yes.
Yes.
So as has been discussed, the biopsy comes to us and we have to give the exact typing of tumor. We do the predictive biomarkers and that would, categorize the patient into a certain subtype. We have some subtypes, as she mentioned. We have triple negatives, we have HER2 predominating, we have hormone receptor positives. So that would, help her to tailor the treatment and also prognosticate the patients in many areas. I mean, most of the patients like that. Yeah.
Okay. All right, so we're going to continue this conversation in just a few moments from now. Breast cancer is extremely common, viewers, but rarely discussed. And before we slip into a short break, we'd like to in fact play out this soundbite of Dr. Preeta Reddy, Executive Vice Chairperson, Apollo Hospitals Groups, on the importance of diagnosis, early detection. We'll talk about that as well with our doctors, our experts here, and how one can quickly diagnose and then get in the best line of treatment, something that can help give a very, very good life to the patients, to the survivors of breast cancer.
The focus on women's healthcare and the way healthcare is delivered for women is not enough. And we know that, when you focus on women's health, it actually has an economic impact. It has a global impact. And that is why we said, let's do Apollo Athena. The Apollo Athena Cancer Center is one portion of taking care of this need. So it is a movement for a focus on women's cancer at this point. And we want to deliver cancer care which is targeted for women, whether it's immunotherapy, precision medicine, the use of research, the use of AI in the way we formulate our clinical pathways, to surgical intervention, which is purely state of the art with highly skilled people, the use of robotics, the focus on infertility for women with cancer care. So all this has been thought through with highly skilled, highly trained personnel to deliver it for women, because I think focus is required. Focus is the answer for better outcomes, and that's what Apollo Athena in Delhi will be doing.
Welcome back. We're having a very important conversation on breast cancer, diagnosis, prevention, and what all should one do, if at all this is something that affects your loved one. These are questions that all our experts are answering. I'm going to get back Dr. Venkat in this conversation because we've been speaking of reconstruction. Doctor, if you could throw a little more light on the kind of options that you as a medical professional have nowadays. How much has this field advanced as far as reconstruction is concerned?
The last 2 decades there's been huge strides made in the reconstruction arena. It's potentially because most people, especially in the West, seek reconstruction if the breast is removed. And it is a national guideline to do so. So this has spurred the growth of this field. Today we have 2 main groups of options. One is using synthetic material like implants, like breast implants to replace the breast, or using patient's own tissue.
Do you get these questions from patients, asking you on whether the marks of the stitches will stay, how will it look? I'm sure you get a lot of these questions. What do you have to tell them, doctor?
Well, 100%, especially when you start talking about taking tissue from elsewhere, the fear is they're going to have an operation in the breast. Now we are talking about surgery elsewhere as well. So that is a fear. But of course, it is whatever we are doing is fairly superficial. It's on the surface. We are not dealing with any deep organs. So that way, you can reassure them. So they are very hidden scars. So yes, they have apprehension about the scars. but to have a fine scar is much better than having no breast. So that is the
Absolutely.
kind of trade-off.
Dr. Venkat, coming back to the treatment, systemic treatment will shrink tumors if at all everything goes well. How important is that for proper reconstruction? How significant is that?
It plays a big part in restoring the breast to normalcy. Reconstruction, there are two folds. You can take part of the breast and reconstruct with oncoplasty procedures, which the oncosurgeon does most often. And then you can remove the whole breast and then reconstruct the whole breast. For the first bit, it's of very big importance. For shrinking the tumor, it would be possible to do oncoplasty procedures and preserve rest of the breast.
Understood. So what role do genetics really play in this? Dr. Kavita, a lot of people think that if there is a cancer incidence, breast cancer incidence in the family, there's a big chance, that the next generation perhaps would be carrying that gene as well. How much truth is there to that belief?
So, in all, we have 5 to 10% of cases of all breast cancers that can inherit the gene, and that is the highly penetrant gene, that is BRCA1 and BRCA2, which are most talked about.
Okay.
So I think that fear should not be there, that if a mother is getting a cancer, that the daughter, she'll transfer it to her daughter anyways. So it's just 5 to 10% of the chances.
Dr. Jyoti Wadhwa, you'd like to come in. Also, I'm adding a question here. Some people tell us, and this is what I hear, and please tell me if this is absolutely wrong or if it's correct, that there's a chance that the mother has it, the daughter may not have it, but the daughter's daughter may have it. This is also what a lot of people believe in. Is there any truth to it?
Yeah, definitely. So it's not that if somebody has... So one important thing to realize is that even if one may have inherited an altered gene or mutated gene, it's not 100% that person will develop cancer.
Okay.
So that's don't live under the fear.
Dr. Jyoti Arora, you're also talking to us about a treatment in which you shrink the tumor, I understand, even without a surgery. Even that is possible today?
So the recent advances, that is cryoablation, where we freeze the tumor. So it is as simple as doing a biopsy where we put a needle in, and that will, if it is a smaller tumor, we can freeze it completely and the tumor dies. So that means that it has almost the same results as a surgery, but this is in selected group of patient. We have to select a patient wisely. It is not to be offered to all the patient, but in selected group, it will have same results as that of surgery without giving a scar, without taking the patient under GA or to the OT.
What is the use of AI today in predicting that, I have a risk factor, this is something that could happen to me,
So there are softwares, and Apollo is working on one of them, which is called Mirai software, and it's an AI tool where, on the basis of the mammogram as well as on the history of the patient, on the basis of which we can predict what would be the risk of that patient in developing cancer. So they may not have a family history, but still, on the basis of the mammogram, the digital information that we get, we put it into that software, and that will tell whether this patient has a high risk or a moderate or a very mild risk or a general risk.
Dr. Geeta, I'm going to put you my next question, and this has got to do with cancer survivors, not just in something that Dr. Venkat also spoke about, not just having good treatment, but also good quality of life. That is very important. How have things changed over a period of time in your practice as an oncologist that you see all of these things happening, that you want to give your patient a good life after all of these treatments are done?
So at Apollo Athena also, we are very, very focused on this. We want to talk of all those things that can go wrong with, not wrong exactly, but the kind of side effects or various aspects of the body which takes a beating during the treatment, and afterwards we take care of those bits. It could be about bone health. We have to address things like fertility issues in young women who are going to who are dealing with cancer. We talk of physiotherapy, we talk of psychological counseling, we're talking about menopausal symptoms which could set in because of the treatment that they receive. So all in all, I think we have to create that environment wherein women are not just surviving breast cancer, but they have to be thriving after breast cancer.
That's right, and that's the reason why so many doctors come in, isn't it? It's not just about one oncologist. Final words from all of you, 10 seconds each to every doctor here on the panel. All of you helping patients. What's your word of advice, beginning from Dr. Kavita?
Biopsying a tumor can spread the cancer is a myth.
Okay.
Please don't delay
Okay.
your diagnosis.
Important
on
to
that.
say that because, like you said right at the beginning, Dr. Geeta, that it's got nothing to do with education. It's more about awareness, and that it doesn't cause the spread of cancer is something that Dr. Kavita is underscoring. Yes.
So don't let fear of finding out something stop you from getting your screening mammography done. There are myths like it's very painful, there is radiation, they're all
That
myths.
the radiation itself will cause cancer.
No,
from
thi-
the
this is-
mammography, this is what I hear
This is
very often from a lot of
absolutely a
people.
myth. That's why I
if I do a
brought this.
mammogram every year, then I'll probably
No.
end up with cancer, is what I
No,
hear.
that
It's
is
the truth. I'm sure you hear it, doctor, also, right?
I do. That's
Yes?
why I'm talking
Yes,
about
yes.
it here. It's a complete myth. So do go for your screening mammography every year from the age of 40.
From the age of 40. Dr. Jyoti Wadhwa.
So I would say that breast cancer can be prevented to a significant extent by leading a healthy lifestyle, of which diet and exercise are an important component. The other thing I want to emphasize is that early detection is very much possible. And early detection is, in fact, our biggest weapon in fight against breast cancer. And therefore, do undergo appropriate cancer screening tests and consult a doctor in time for it to get detected early.
It's extremely curable, is what I have heard from so many doctors.
Definitely.
One of the most curable type of cancers, viewers, Dr. Venkat would like to add to that, is perhaps breast cancer.
Certainly, the survival following breast cancer, with all the advances in treatment, surgical, medical, oncology, and so on, is much better now. Having said that, that's one of the reasons, the reconstruction. Surgery for breast cancer need not necessarily end up in a deformity, and the patient does not need to cope with it. It is important they have the conversation about how best the breast could be restructured or reconstructed at the time of mastectomy or removing the cancer, the lumpectomy. It is so important for them to have the conversation without the fear that that will interfere with the cancer treatment or their survival.
Dr. Geeta?
So I think it is time that we normalize breast cancer, because with such fantastic treatments around, with lesser treatments giving us as good outcomes as more radical treatments, I think it is time that we normalize breast cancer, cut out the fear, and come early to the surgeon or the medical physician to get diagnosed, because like everybody said, early diagnosis is the key to beating breast cancer.
Cut out the fear, and I would say maybe even cut out the stigma, because there should be no stigma attached to any form of cancer, breast cancer, even more for the reasons we've already discussed. I'm going to thank you all for joining in, for your insights. What today's discussion clearly shows is that the science is already there. There's no dearth of it. From precision imaging, targeted therapies, to conservation surgery, reconstruction, breast cancer treatment has evolved tremendously. From what we saw perhaps 20, 25 years ago to now, things have seen a sea change. The challenge really is ensuring that this knowledge reaches every patient and every hospital in the country, and that's why discussions like these become very important. That's exactly what platforms like Apollo Athena Cancer Conclave also aim to accelerate, because breast cancer care should be guided not by fear or habit, but by evidence, collaboration, and compassion. Thank you for joining us. This continues on the other side.